Welcome to YARKUD International. In this section, we are going to discuss the Saudi Prometric exam question and answer. So here, today, we are moving on to the important medical question and answer. So first question, the nurse teaches a client with a COPD to assess for signs and symptoms of right-sided heart failure. Which of the following signs and symptoms would be included in the teaching plan? Option A, clubbing of nail beds. Option B, hypertension. Option C, peripheral edema. Option D, increased appetite. Okay, these are the signs and symptoms. So here you have to remember there is a two type of heart failure. There is right sided and left sided. There is to differentiate this one. There is different signs and symptoms are there. So you have to remember always left side L for lungs. Left side L for lungs. Okay. So lung complication will come. If it is left sided heart failure, there will be mostly what is the complication? Lung complication, like fluids filled with the, because the fluid retention will be there, fluid filled with the lungs around that. There is pleuritis will be there, pulmonary edema will be there. There is a crackle sound inside the lungs, okay, while the auscultation. These are the symptoms of left side heart failure. What about the right side? Right side, there is a circulatory problem. So there will be the water retention will cause the peripheral edema. Okay, so there will be patient complaint of peripheral edema will be there. Hypertension also will be there. Here, see here, they have asked right side heart failure. So you can take 2 points here. Hypertension also there, peripheral edema also there. So what you will be do? Okay, here you have to listen to the carefully to the question. Okay, here they are asking for signs and symptom of right side heart failure. Okay, so teachers client to assess. Okay, client is going to assess. Client cannot assess the hypertension. Okay, so client will assess what? Peripheral edema. That will be inspection by the client and they can report to the doctor. Got the point? Okay, like that only you have to choose, because two answers are similar. You have to take the best answer according to the question. So here the answer is peripheral edema. Got the point? Okay. Likewise, you have to choose the answer wisely. Okay. Can we move on to the next one? Which of the following ABG abnormalities should the nurse anticipate in the client with the advanced COPD? Okay. So some problems, so that should be nurse anticipate. Okay. So with which of the ABG? So here you have to remember there is mention increase PaCO2, increase PaO2 and increase pH and oxygen saturation. Okay. Always remember eliminate the wrong answer. Okay. Increase PaCO2. It is normal, right? So you should not be eliminate. You should not be have the need to anticipate. Okay. So increase PaCO2, just eliminate this answer. And increase oxygen saturation, it is good. So D also you can, no need to be anticipate. Remove. Okay. If it is option A or C, now we have to find out. Increase pH is nothing about COPD. Okay. So COPD is mainly to the O2 and CO2, oxygen and the carbon dioxide elimination problem. Okay. So oxygen intake and carbon dioxide elimination problem. So there is an increased PaCO2. There is so much of carbon dioxide inside, not eliminating. That is a problem in the COPD, right? So this is to anticipate, nurse to anticipate this problem. Okay, no need to anticipate with increased pH. Okay, so now COPD, according to the condition, what should be anticipated? It will be the answer increase PaCO2. Got the point? Likewise, only you have to be choose the answer. Okay, let's see the next one. A client with acute asthma is prescribed short-term corticosteroid therapy. What is the rationale for the use of steroid in client with the asthma? Okay, so corticosteroid is a steroid medication. So what will be the action corticosteroid? Why we are giving to asthma patient? We are corticosteroid, many patient we are just giving, right? So some patient it will be suppress the immune. Okay, we know that. So here mainly asthma, there is a airway will be inflamed. Because of that only airway is very narrow. That's why asthma attack is coming. So here they are using the corticosteroid for what? To anticipate there will be the inflammation in this. So anti-inflammatory effect. Got the point? So answer is here, asthma patient. Why corticosteroid therapy? Because the corticosteroid have an anti-inflammatory effect. So it will be reduce the inflammation and the asthma attack will be reduced. Got the point? Okay. Let's see the next one. Your patient becomes restless and tells you she has an headache and feels nauseous during hemodialysis. Which complication do you suspect? Okay, for this one, you have to know what is a hemodialysis. We know that with the machine, we will be doing the dialysis. Okay, hemodialysis. Blood will be, the purification will be done under hemodialysis. So here, mainly, what you have to remember, okay, what is the complications of this? Okay, so you have to remember the complication will be hypertension. Main complication of hemodialysis, it will be hypertension, hypo. Okay, so hypotension. And one more is called dialysis disequilibrium syndrome. Okay, dialysis dis, there will be the complication called dialysis disequilibrium syndrome. Okay, so this is because suddenly there is a substance of our blood, okay, like a urea will be suddenly it is eliminating, okay, removing from the blood, it will cause the brain cell to inflame. So what will be happen? There is starting from headache, then nausea, then the patient will be selling the symptom like I have having the like a confusion. Patient will be confused, then coma, then it will lead to the death also because it is very severe case. So dialysis disequilibrium syndrome should be noted immediately to the physician. So here the complication you suspect which one? There is no hypertension. There is no hypertension symptom also here. Headache and nausea only given. So what will be the answer here? Disequilibrium syndrome. Okay, it is called dialysis disequilibrium syndrome. Okay, sudden shifting of the blood will be removing of urea and all. It will cause the patient suddenly going to the blood cells will be inflamed and there's headache and the nausea. Got the point? So this is the answer. So each thing you have to know the rationale. Got the point? Okay, we'll move on to the next one. A patient is experiencing which type of incontinence if she experiences leaking urine when she coughs, sneeze, or lift heavy objects? It's very easy question, right? Because they have mentioned you while coughing, sneezing, lifting, what is actually doing? They're giving some pressure to bladder, coughing time, sneezing time, some heavy lifting object, it will cause the bladder to giving some pressure, okay, like then the patient having incontinence, like that means it is stress incontinence. Okay, the answer is stress incontinence. So these are the many different type of the medical questions. So as we continue in the next video also we'll see more medical questions. So here the YARKUD International, we are giving the online training for Prometric, SNP, MOH, and Omen Pearson View nursing examination, DHA, HAD, OET, and IELTS training. All the nursing examination training will be available here.